My name is Herve Brissot. I'm a diplomate in small animal surgery. And I'm working in a private hospital, referral, which is actually a teaching hospital because I've got a commitment with the Nottingham University. And I'm doing that for the last, I'm a diplomate for the last 15 years now.
Herve, last week we had European Antibiotic Resistance Week. It's everywhere in the press. We've got people commenting, including presidents. It's a vast subject, but what does it mean to you as a practicing clinician?
The thing is that because of my specialty, I'm seeing a lot of cases that have been treated with antibiotics for a long time before eventually practitioners or eventually owners try to find another solution, and surgery is frequently a solution for chronic infection, which is good because it might give a solution. It's also difficult because sometimes it puts ourselves in a very complicated situation, meaning that you need to remove an infected tissue where you know that if you've got a problem, you're going to have a bigger problem because you've got multi-resistant bacteria. And it's one of the discussions we're having with the people of the panel that still we need to remember that when antibiotic is too much, you need to find some other solution rather than to carry on to dig in more and more complicated antibiotic that maybe should not be used for a veterinary patient. And then surgery is still this kind of solution sometimes, like for example for chronic ear disease. So this is a problem we are dealing with quite frequently because we end up having cases sent because, well, an analysis has been done and everything is resistant, and what's the next step? And as a surgeon, sometimes, surprisingly, we end up at the bottom of the line, like the last resort. Also, potentially, we should have been the first one involved at the beginning. So that's where I'm seeing the things. And antibiotics and antibiotic resistance is a subject that as a surgeon and as a surgeon training some students sometime or some other resident, I try to focus on because I'm a very pessimistic surgeon, and I'm very pessimistic about the fact that we might end up at some point being very restricted in the number of antibiotics we've got, and just to try to have a better teaching on how to use it, when to use it, and what to do not to use it. And surgery is very important for that because a lot of antibiotics are prescribed because of imprecise or inefficient surgical technique or environment to try to think that, well, if the surgery is not great, then the antibiotics will do the job. And what we try, and I know that a lot of diplomates like me are doing the same things, is to explain that no, surgery should be first and then should be helped sometime with antibiotics. And that's this kind of a reverse thinking that we try, because it's not me, but and I guess the OCVS also is part of that. We try to implement to general practitioners that surgery and antibiotics are going together, but a good antibiotics is never going to make better a bad surgery, basically. So that's where I'm thinking, what I'm seeing anyway.
And if we look, you've kindly given up your time to be part of this GRAM initiative. Something started actually quite a number of years ago, but when we surveyed veterinarians, excuse me, recently, they still said that they felt they needed more advice, more practical guidelines from experts such as yourself, and that's why we're here today. In 5 years' time, if you look at this GRAM initiative, my goodness me. I think afterwards. If you look at GRAM, what do you think, what do you hope GRAM will bring to those veterinarians?
I think the hope is to have a better understanding on when and how to use, and hopefully to try to de-escalate. So I think, unfortunately, over the last 10 years, or fortunately, I don't know, we had access to more and more sophisticated or last generation antibiotics, and we kind of, as a profession, maybe forget the common sense or forget the simple things. And we need to just replace a strategy where there is a plan A, B, C, and not try to do everything with the best one or what is supposed to be the best, or anyway the most recent, where simple can do the job. And I guess the GRAM could be also the occasion to speak with lab to say, well, we don't have ability now to have access to simple antibiotics. So if I want to use just a penicillin J or a simple ampicillin, how the hell am I going to do that? Because it's no more accessible. I need to dig in human hospital to try to find some or whatsoever. And I think it's a shame, because if it was accessible, then it will be done better, I guess. And as a surgeon, I'm always looking for IV antibiotics, and it's difficult to find simple IV antibiotics. Very quickly, we need to escalate to amoxicillin clavulanate or fluoroquinolone, where again, finding something older, simpler, will do the job, but unfortunately is not accessible. So the GRAM is for the vets, definitely, but it might be also the occasion to rediscuss the disponibility of simpler produce from the lab to the vet, because I guess they're also doing with what they've got on their shelves, which is fair enough.
And looking at the future, you used the word simpler several times there, getting back to basics.
Yeah.
If if we look at the future of antibiotherapy, what is it for you?
Well, I think we try also, we had on the GRAM a part about hygiene and asepsis and antisepsis. And as a surgeon, what we try to probably to emphasize is that you don't do surgery in bad conditions. So the future of the antibiotics is to prevent the use of antibiotics, to me. And that is to rediscover basis, which is hygiene, good practice, increase the sensitivity of the vet and of their personnel about how to put some gloves, to just change the dressing, all the kind of thing that will make that the need for antibiotics will be less important. So that's probably the first part. And the second part is also, yes, to think about the future, and the future is to try to treasure a little bit the antibiotics we've got for the moment, to try to keep them efficient and useful in 10 or 15 years, and not to end up in 15 years saying, well, we're in trouble because we don't have any antibiotics usable now to face all those resistance that we did create over the last 15 or 20 years.